Hello, I'm Dr. David Miller. As a cardiologist who has focused on preventive care for seniors for the past 2 decades, I need to tell you something that might be difficult to hear. The very medication you take every day, perhaps even one prescribed to protect you, could be the thing that is silently weakening your heart.
That is a truly sobering thought to begin with. Welcome everyone to Health Voices. I'm Sarah. Doctor, that statement is incredibly concerning. We are taught to trust our medications. How can a pill, often prescribed by a trusted doctor, end up being a hidden danger to our most vital organ?
It's a critical question, Sarah, and it lies at the heart of understanding senior health. The body you have at 65 or 75 does not metabolize medications in the same way it did at 45. Your kidney function may be slightly reduced, your liver processes things differently, and the cumulative effect of a drug taken for years can create problems that were never anticipated. I have seen thousands of patients in my career whose shortness of breath, fatigue, or irregular heartbeats were not caused by a new disease, but by the side effects of a common pill they had been taking for years. This is not about creating fear. It is about creating awareness, because you are the most important advocate for your own health, and an informed patient is a safe patient. Today, we are going to discuss 7 common classes of pills that may be harming your heart, ranked from concerning to the most dangerous.
This sounds like an essential conversation every person over 60 needs to hear. Where do we begin, doctor? What is the 7th item on our list?
We begin in nearly every medicine cabinet in America. Number 7 is non-steroidal anti-inflammatory drugs, better known as NSAIDs. These are medications like ibuprofen and naproxen, sold under brand names like Advil, Motrin, and Aleve. They are the go-to solution for arthritis, joint pain, or backaches. Many seniors take them daily, assuming that because they are available over the counter, they must be completely safe. This is a dangerous assumption.
How exactly do these common painkillers put a strain on the heart?
They work by blocking enzymes that cause inflammation, which provides pain relief. However, those same enzymes also play a role in protecting the kidneys and maintaining blood vessel function. When you take NSAIDs long-term, they can lead to 2 major problems for the heart. First, they can cause your body to retain salt and water, which increases blood volume and raises your blood pressure. Second, they can constrict the blood vessels leading to the kidneys, impairing their function. For an aging heart that may already be working harder, this added strain can be enough to push it towards heart failure. This isn't a small risk. In fact, the American Heart Association has issued specific warnings stating that regular use of NSAIDs can increase the risk of heart attack and stroke. I had a patient, a gentleman in his early 70s with mild arthritis, who was taking the maximum dose of ibuprofen every day to manage his knee pain. He came to see me because he was feeling progressively more breathless. His blood pressure, which had always been normal, was suddenly quite high. The culprit wasn't a new heart condition, it was the daily painkillers. We worked with a rheumatologist to find a safer alternative for his pain, and within a few months, his blood pressure returned to normal.
That's a powerful example of how something seemingly benign can have such a ripple effect. What is pill number 6?
Number 6 is a specific class of medication for a very common condition. Certain diabetes medications, specifically a class called thiazolidinediones, or TZDs. Drugs like pioglitazone fall into this category. They are prescribed to lower blood sugar in patients with type 2 diabetes. While they can be effective for that purpose, they carry a significant, well-documented risk for the heart. The FDA has mandated a black box warning for these drugs, the most serious type of warning, because they can cause or worsen congestive heart failure. They work in a way that encourages the body to retain fluid. For a senior who may already have some degree of heart weakness, this extra fluid volume is like asking an already tired person to carry a heavy backpack all day long. The heart simply can't keep up, leading to swelling in the legs and fluid buildup in the lungs.
So, This is a case where a medication that helps one condition can seriously harm another.
Precisely. And because the symptoms of early heart failure, like fatigue and shortness of breath, can overlap with general symptoms of aging or diabetes, the connection is often missed until the problem becomes severe. If you have diabetes and any history of heart issues, or even just persistent leg swelling, it is crucial to have a conversation with your doctor about whether a TZD is the safest choice for you.
That's vital information. Now for number 5, a pill that millions of seniors take every single night.
Yes, number 5 is sleeping pills, particularly the class known as sedative hypnotics. This includes drugs like zolpidem, sold as Ambien, and older benzodiazepines. I have immense empathy for anyone struggling with insomnia. It's a debilitating condition, but long-term reliance on these medications can be very hard on the heart. These sedatives work by slowing down your entire central nervous system. While this helps you fall asleep, it also depresses your respiratory drive. This can cause or significantly worsen sleep apnea, a condition where you stop breathing for brief periods during the night. Each time you stop breathing, the oxygen level in your blood plummets, and your body releases a surge of stress hormones to wake you up just enough to breathe again. This cycle, repeated dozens or even hundreds of times a night, puts extreme stress on the heart, leading to high blood pressure and dangerous rhythm disturbances.
So the very pill meant to bring rest is actually creating a state of intense stress for the heart overnight.
Exactly. It provides the illusion of rest without the true restorative benefits. Furthermore, these medications can increase the risk of falls and confusion, especially if taken with other sedating drugs. Poor sleep must be addressed, but finding the root cause is always a safer long-term strategy than relying on a pill that can slowly harm your heart and brain.
Let's move on to number 4, which you mentioned is a type of mood stabilizer.
That's right. Number 4 is an older class of antidepressants called tricyclic antidepressants, or TCAs. This includes drugs like amitriptyline or nortriptyline. While they are prescribed less frequently today, some doctors still use them for depression, anxiety, or nerve pain. However, for seniors, they carry significant heart risks. The Beers criteria for potentially inappropriate medication use in older adults, a foundational guide for geriatric medicine, lists TCAs as high risk. They can directly interfere with the heart's electrical conduction system, potentially causing irregular heartbeats or a dangerous condition called heart block. For a senior who may already have a slow heart rate or an underlying arrhythmia, these drugs can be particularly hazardous. They are also notorious for causing dizziness and orthostatic hypotension, that drop in blood pressure upon standing, which dramatically increases the risk of falls. There are many newer classes of antidepressants that are much safer for the cardiovascular system.
This really highlights the importance of regularly reviewing medications with your doctor, especially older prescriptions. What is pill number 3?
Number 3 is something found in almost every cold and allergy aisle, decongestants, especially those containing pseudoephedrine or phenylephrine. Seniors often reach for these to relieve a stuffy nose, but they can be very dangerous for the heart. These drugs work by narrowing blood vessels to reduce swelling in your nasal passages. Unfortunately, they don't just work on your nose. They narrow blood vessels throughout your entire body. This constricts the highways your heart has to pump blood through, which forces your blood pressure to rise. For someone with existing high blood pressure or heart disease, this added strain can be very risky. You might feel jittery, anxious, or notice your heart pounding. That is your heart telling you it's under stress.
So even an over-the-counter cold medicine isn't necessarily safe.
The term over-the-counter does not mean risk-free, especially after age 60. Always read labels, and if you have high blood pressure or any heart condition, it is best to avoid these oral decongestants and opt for saline nasal sprays or other safer alternatives.
Let's talk about number 2, a pill for a very common digestive issue.
Number 2 is proton pump inhibitors, or PPIs. These are medications like omeprazole or pantoprazole used to treat acid reflux and heartburn. Millions of seniors take them daily, often for years, believing them to be harmless. However, a growing body of research has linked long-term use to several cardiovascular concerns. A major review published in the medical journal Heart explored this. They found that long-term PPIUs can interfere with the absorption of essential minerals, most notably magnesium. As we've discussed before, low magnesium levels can lead to irregular heartbeats and other cardiac issues. Furthermore, by altering the gut microbiome, long-term use may contribute to systemic inflammation, which is a known driver of heart disease. These medications are intended for short-term use. If you have persistent heartburn, it's crucial to work with your doctor to find the root cause, rather than just masking the symptom long-term with a pill that may carry hidden risks.
And now, doctor, what is the number one most dangerous, and you said, most commonly used pill that could be weakening senior hearts?
Number one, Sarah, because of their power and how widely they are prescribed, is a specific class of calcium channel blockers. These are medications often prescribed for high blood pressure or arrhythmias, but certain older types, particularly drugs like verapamil and diltiazem, can be risky for some seniors. They work by relaxing blood vessels, but they can also have a very strong effect on slowing down the heart rate. For a senior whose heart function might already be declining, or who has a condition called heart failure, slowing the heart down too much can be dangerous. It can lead to dangerously low heart rates, profound fatigue, dizziness, and even fainting. I treated a patient who was constantly feeling exhausted and short of breath. His symptoms were being blamed on his age. But when we reviewed his medications, we realized he was on a high dose of one of these heart-slowing calcium channel blockers. His heart rate was dipping into the 40s at night. We carefully transitioned him to a newer, safer alternative for his blood pressure, and within weeks, his energy returned. He wasn't just getting old. His medication was too strong for his heart.
This entire list is a powerful reminder of how complex medication can be in an aging body. What is the final message you want our audience to take away from this very serious conversation?
The message is not fear, it is empowerment. I am not telling anyone to stop their medication. That would be incredibly dangerous. I am urging you, begging you, to become an active partner in your healthcare. Keep a list of your medications. Know why you are taking each one. At every doctor's visit, ask, is this pill still necessary? Is this still the safest option for me at my current age? As a heart surgeon and a cardiologist, I have seen too many hospitalizations that were caused not by a disease, but by a preventable medication side effect. You have the right and the responsibility to ask these questions. Your heart is too precious to leave its safety entirely in someone else's hands.
Be an active partner in your own health care. Words to live by. Dr. David Miller, thank you for this incredibly important and life-saving information. For everyone listening, if this has prompted you to think about your own medications, please talk to your doctor and share this video with a loved one. It could start a conversation that truly matters. Don't forget to subscribe to Health Voices for more in-depth discussions like this one.
Thank you, Sarah. And please, everyone, be well, stay informed, and stay heart strong.